I can't sleep when I lay in bed. Too much thinking in my head. I don't know what to do anymore. But come on now, tell me the score. Is there anything I can do to get out of these tragic blues? I'm a victim of circumstance. I never really had a chance. I lay down and stare at my feet. You know the world has got me beat.
Hello and welcome to today's edition of Mental Health Matters. Our guests for today's show are the Family Advocacy Committee. Some representatives from the Family Advocacy Committee are here to talk to us a little bit about their role in the community and the role of a family advocate in some of the provider agencies. And so with us today is Ziamora Saidi.
Yes.
And you work for the Child and Family Institute.
That is
correct. Thank you so much for being here with us today.
Thank you for having us.
And we also have Ann LaBroche. And Ann is with us from Stanford Youth Solutions.
Yes.
Thank you so much for being here with us. Mm-hmm. And Jenny Churchill.
Yes.
And Jenny's from Terra Nova Counseling.
Yes.
Thank you all for being here. And I'm very interested in sort of the work that you're doing and family advocacy in general, so I appreciate you being here because I know it's always a sacrifice to get away from the office and do extra things. So maybe you could start off by telling us a little bit about what is the FAC Committee, the Family Advocacy Committee. And anybody jump in wherever you...
Well, the Family Advocate Committee is each provider that has a contract with the county for mental health services. Children's mental health, thank you. They are to, depending on the size of their contract, they are to employ a family partner. And the family partner or advocate, we use them interchangeably. Mm-hmm. Those folks are required to attend a monthly meeting all together. It's part of our written contract. So we meet once a month as a group, and then on every third month we meet at the big county provider meeting instead of having our own group. So that's where the Family Advocate Committee comes from.
Great. Wonderful. So can you tell us a little bit about the history behind the Family Advocacy Committee, or for that matter, family advocacy in general in Sacramento County? So I think, kind of...
Well, I think it was actually you who mentioned that about 17 years ago you saw there was a need for advocacy from the clients, coming from the actual consumers, mm-hmm. and having to bring that family voice to the table, not just, from the top, but also at the direct services level, where clients and consumers can explain what their actual needs are and share those needs with the service providers.
All right. Ann, did you want to add anything to some of that? Or?
I just want to add that as previously as a consumer, that I was not aware of the family advocate movement for quite some time, and I feel I'm thankful for it, and I'm just interested in the history of it. Glad we're getting out there. For those of us, because I'm not alone. You're never alone, right? If I don't know a lot about it, then there's others. So to continue to speak to it, I think this opportunity is really good. I appreciate it.
It's like Carolyn Cooper, who we consider to be our the mother of family partners. Mm-hmm. We quote her when she said, "Do not talk about us without us at the table." Right. And that's pretty much what we want to bring, the consumer voice, because all of us have that lived experience mm-hmm. to bring mm-hmm. to the table.
Right. And so when you talk about the lived experience, can you tell us a little bit about how, and I know that's not necessarily in the script, but sort of how the added value, why do you think it's so important to make sure that we have sort of somebody with lived experience on those teams kind of giving that feedback, because it really does make a difference, but for some people don't really understand why that's so important.
Right.
Well, I think that the lived experience and we all have our own different stories. Mm-hmm. Having been through multiple systems within the county mm-hmm. and just getting the experience, learning the navigation of it, learning what the county and what programs are out there. It's been invaluable to have all this information, and the fact that we get to share this information with someone. I always say, I had no idea I was working on my internship with all my screw-ups.
Right. I love it.
Right.
Yeah.
So I think, and also there's somewhat of a camaraderie when we're sitting down face to face with somebody. I find that many family members will share stuff with a family partner or an advocate more than they will with a therapist. Yeah.
I've witnessed that relief, that when you first tell that little snippet of information when you're first starting to build rapport with a family, and I've literally seen them physically relax when they realize that you've been there too, I've been there too.
Right.
Yeah.
We've walked the walk. We've had the doors slammed in our face. We've gone to the many different service providers, and not just within the county system, but all service providers. We've faced the red tape, the bureaucracy.
Yes.
And so working with our clients, we are able to avoid having to deal those long routes to obtain the services that they need.
So it's really that knowledge about the navigation, but also sort of that camaraderie and that feeling that I've been there. You can trust me, that I'm not looking at you with judgment or blame or any of those
But
things.
with compassion.
With compassion.
Exactly.
Compassion, it really, judgment will close compassion's eyes. And you just, and for them, the families, to witness that compassion coming back, just that little piece of it, and then to know they're not alone.
I love that you said that.
Yeah, that's great. And on the other end of it is that, I forgot my thought.
It'll come back to you, I'm
Okay.
sure. No, I appreciate the conversation, and I felt a lot like Ann when I first started to work at, it was Mental Health Association back then, and when we did some of this work, and I got there, and I was really going to try to become a clinician. I had graduated from my undergrad, and I got there and I thought, well, there's this whole movement that I wasn't aware of, and I'm one of them. I'm here. This is me. This is why I'm here. And so I kind of bypassed all of that, and I decided to go another route and really, kind of join the movement and really work, so hard to make sure that these voices are elevated, the family and the consumer voice and the youth voice as well.
Yes.
And that really these are the primary stakeholders in the public mental health system and the voices we should be listening to. And now we look at our community, and we have such a wider array of diversity in our community, and so the needs are even growing more to have more and more family advocates and more youth advocates that are more representative of all of our diverse cultures and ethnicities and sexual identities here in Sacramento, and and how important that is. That I think it's the most important thing in the system, because you open those doors, you begin those conversations with people, and really try to meet people's needs where they're at.
Right.
Not try to fix them, but come alongside them,
And they also
that's a relief in itself.
They get to see that there is hope.
Well,
Exactly.
That's it.
Yes.
Because,
They see you folks working and doing well.
and then they get little snippets, like Ann said, of our background and our stories. They're like,
Wow.
I never would have thought that was you or something.
Right. And you come
Right.
to work every day and
Yeah.
grocery
They
shopping.
get hope that they can make it through what they're going through.
Absolutely. I think the hope is such a big part of it. Yeah, absolutely. So what are some of the challenges? And I know that's always hard, because these are great jobs, and it's great to do the work that you love and work with people that have been through some of the same things that you have. But I know there's always challenges, and I think it's always a challenge to sort of be the difference maker, the person that might say things that ruffle people's feathers, or
Exactly.
or be the
Yes.
voice of the families that maybe they're not represented in another way. So sometimes you do have to say some of the uncomfortable things, but it's part of a partnership and within a team environment, I think, for the most part. But I know challenges do exist, so I'm just curious as to maybe.
I think funding is a big challenge,
Yeah.
because even if, our clients meet criteria, eligibility for services, if there's no funding, they're not going to get those services they need. So that's one of the biggest challenges that we encounter.
So funding for resources for the families.
Exactly.
Yes.
And not just, for mental health or AOD or the children's welfare legal system, but all service providers, face those challenges, budget cuts. So
Right.
even, we might have a family that meets all the criteria for subsidized housing or subsidized childcare, But with all the cuts that exist for all the service providers, they might not get those services they need.
Right.
A 2-year waiting list
Wow, wow.
Yes.
For what types of things do you think?
on the subsidized housing.
On the housing, yes,
Yeah.
the housing's always the hardest.
Exactly.
Yeah.
And I don't even call them wait lists anymore
No.
because there's no guarantee
They
you'll
never
ever
get
be
through.
called.
Yeah,
Right.
yeah, that's the
so
thing.
they're just
Yeah,
lists.
like Section 8 or any of that.
Exactly.
And hopefully, and I don't know exactly where this is going at this point, and you folks may know more than I do, but I know that they're opening up some more full-service partnership slots for families and I think for youth. So hopefully some of that helps, because a full-service partnership is really supposed to be whatever it takes. So if it's housing, if it's treatment or supports or whatever it is, it's really the goal of the full-service partnerships. And I've always felt that for a community as large as Sacramento is, we don't have as many full-service partnership slots as we really need.
Right.
Because the Mental Health Services Act, it can bridge some of those places where other funding cannot cover.
Exactly, right.
And that was the goal.
And I think another challenge that we face is the lack of understanding of the intersectionality that many of our consumers face. It's not just the need for mental health services, not just for AOD services, it's everything. It's being able to put food on the table, health access to quality healthcare services.
Culturally competent services.
Exactly.
Somebody that reflects your culture, your identity.
Yes. So being able to address all of those needs, it's something very important that service providers in our behavioral system need to understand, that it's not just about getting to the therapist appointment, but being
Well, yeah,
able
sometimes
to
it's the transportation
Exactly,
to get there.
yes.
Well, and that was one of the issues with like the adult system of care, which is an alcohol and drug county-based program. Its location is off Power Inn Road, and
it's hard to get
if you have somebody who's up in, north of Citrus Heights or North Highlands, they have no transportation, and et cetera, et cetera. I mean, the chances of them actually accessing it are pretty slim.
Well, and then sometimes I know that there's, frustration because there's no shows or people miss their appointments, but sometimes it can be a whole day, to carve out the time to get to that appointment. If you have to take public transportation or navigate that in some way that isn't readily available to you, that can be a whole day.
Yes.
Oh, it is a whole day.
And so,
Or just even being able to take the time off if the employer is not
There you
willing
go,
to
as
give
well.
you that time off.
And I think because what we really need is another challenge we face is that a true comprehensive plan. So the youth can come in and have those services because the youth qualifies, right, through access.
Maybe the family.
But the family has needs.
Absolutely.
The family has needs, the needs we're talking about, but also mental health needs. And, if we truly want to make a difference for that child, then we need to make a difference for that family. And the way to do that is what you all are speaking to, what we try and speak to, is how can we provide services to the families as well.
And many of that is, that was the design of the wraparound programs. Are
Yes.
any of you wraparound
Yes.
within the wraparound
I do.
system? Yeah,
I'm
you
a
do.
wraparound graduate myself.
Oh, are you?
Yes.
Yeah. So, that was the design. I know it doesn't always kind of work the way it should, but the idea is to really wrap it around the family.
Yes.
But that's also a stepping stone, because where I work, we take a certain level of care for the children that come in. And you have to just meet so many markers to qualify for wraparound.
That's true.
So then, as a family partner, I'm helping and trying to work with this family. And I know what their needs are, they're expressing what their needs are, and we have to wait till they have these little check boxes to get the services.
And sometimes it means things kind of escalating into a more difficult situation before you really meet those needs.
Yes.
And I think ideally the wraparound was supposed to really help those children and families before they got into the higher levels of care.
Yes.
And a lot of counties and communities are using it sort of differently. They're using it to bring people out of care.
As a step down.
As a step down. And I really, the wraparound model is really, that isn't the ideal use of it.
Right.
And again, it kind of goes back to those, the funding, scarcity of funding, and those resources and decisions are made.
Because we're not putting because we're not tending to the smoldering, right? We see a problem and we're just like, well, let's just, and then it becomes that full-blown
It's a huge
fire.
fire,
Then we're all
yes.
running around,
Exactly. And it's not-
reacting, not being
and
proactive.
it's much harder for the children and the families then too, because now things have gotten so much worse.
Yes.
Some counties do it very differently, and it's harder in a larger county like Sacramento, I think, but where they really, and everybody's on the team. So the child welfare people are there, and the probation, and and everybody's talking about these things, and there's really much more of an integrated delivery, and I think sometimes that's really helpful.
Yes.
I know that I think you guys are primarily behavioral health.
Yes.
Do you communicate with the child welfare probation? I mean, I know you do, but do you feel like it's a real, like you're in there? Are you embedded there in a way? And
Within our agencies, we probably all have. I know that we have some of the child welfare children come through.
Right.
It's not. I mean, they can go to a lot of different places
Right.
to meet the needs and requirements of the child welfare system.
Right.
Yours too?
Yes, and previous programs I've worked with specific to juvenile justice.
Right,
It's the.
But they don't have the level of family advocacy.
They don't, and that is something just briefly that I would speak to, is that sometimes a family advocate is brought in because they have to be brought in, right?
Right.
It's under that contract.
Token.
Right, and that's not, it's not okay. And we need, our voices really need to be heard, and stepping back into a place where that's more, where my voice is heard and I am appreciated for the lived experience, and I'm not, I was going to mention an additional challenge that we face is sometimes acceptance, and that we're not just that mom who had that kid or that son or daughter,
Yeah, I used to joke when we first started doing this work that we're not just the side dish of pasta you didn't order.
right.
I know. I think some people probably got sick of me saying that, but sometimes it felt like that, and it really felt like that back then because it was this whole paradigm shift in Sacramento County, and we had a wonderful mental health director at the time, Tom Sullivan, who believed in this, and so he really wanted to see family advocates everywhere. I mean, he really started all of that in terms of funding those positions and making sure that all of the agencies on the behavioral health side had advocates, and it hasn't really spilled over to some of the other departments like in the way that we would have liked to see a fully comprehensive system of care. So we're all sort of talking to one another, and I don't know how much movement we've had since those early days as far as expanding. Like I think there was a certain number that were allocated out, and we haven't really built upon that in terms of like the number of family and youth advocates. And if a new provider comes along, then they might get one, but we need many more, in my opinion, at least.
I agree.
Yes.
I agree. Absolutely.
And so you all probably carry a caseload.
Yes.
Yeah.
I don't.
No. Okay.
No.
Okay.
Yes. Therapists will just refer clients to me, so I don't carry a caseload.
Okay.
No.
Oh, that's kind of how I do it too. If they get referred and try to get them where they can.
Right. But you're dealing with the direct services.
Yeah, absolutely.
Yeah.
That's our bread and butter.
Yeah.
Right. What are some of the things, maybe success stories that you could tell us, or if there are things that you hear from families and how they really value your participation in that?
Well, I recently was asked by our school district that we partner with a lot to meet with a mom and her daughter with the school worker at their home to try and talk to the mom about the importance of the child's education and her not going and how it's the attendance program.
The SARB.
Yeah.
Yes.
And so what happened was I don't know what I did or not, but the school worker emailed me the next day and said, I don't know what you did, but she showed up at school. She was happy. She stayed all day and everything.
Yeah,
So
wonderful.
it was successful until the next day when they decided
There's
they're gonna
always
move.
peaks and valleys,
They're-
right?
Now they're going to move to Chico, so
Yeah.
so there's goods and bads,
Definitely.
Do you all work on IEPs or help assist with that?
I was
Yeah,
at
and
one
that-
this morning, actually.
Yeah, I have two tomorrow.
I shouldn't use acronyms, I'm sorry. I apologize to the audience because that would be an individualized education plan. So if a student has some kind of mental health challenges or other kind of disabilities, that oftentimes that's helpful for them to have in place at the school so that
Right.
there's supports that can
The
be brought in
additional
and they
supports.
get additional help, and it's so very important. And I remember kind of even the beginning of all of that with the individual individualized education plans, and hardly anybody knew how to do them. And, you know, we always went to the experts, the area board,
Area board three.
Yes.
They always really helped us back in the day, and it sounds like they're still helping with that. But it's such an important area as well, because if a child's not functioning well in school, then, you know, their life will just be that much more challenging further down the line. And so to really have that support. So I'm glad to see that you're all doing some of that work as well.
Yes.
And speaking of that up and down of success, right? When I answered this question, when I was pondering, I thought success it's a different concept for different families, right? I recently worked with a family where mom advocated for her young man to get treatment. That went, but and she was successful. She was able to find him care. However, that meant voluntarily placing herself and her family in the child welfare system.
Yeah.
And so where
That's still happening.
that's not yes.
It has to. It's-
And so she, in essence, had to abdicate her rights at this moment in time in order to make sure her son received care. And that's so success because he's receiving what he needs.
Right, but maybe
You had to go a route that it's not what, the ideal, but it achieved what it needed to be achieved.
That's that family voice and choice really needs to hold as much weight, if not more weight, than the system.
Exactly.
Quote unquote the system. Right.
No, so very true. And really all of that was happening back in the day when they started wraparound, and that was the reason why wraparound was so very important. And even some of the the work that SAMHSA has done around children's system of care, and that was the purpose really, was to make sure that parents did not have to abdicate their rights in order for their children to get mental health services. And the fact that it's still happening makes me very sad. And I know nothing's perfect, and institutional systems tend to be imperfect at best. And it's always a work in progress. And so it's nice to see that there's this paradigm shift, and that all of you are doing this beautiful work still. Yes, right. But I think we have a ways to go. And so to that end, I'm going to throw a question out there. What kind of things would you really like to see in terms of, if you had the ideal situation as you work with families and funding wasn't an issue? What kind of things do you think would you like to be able to offer families, and would you think would be really helpful to them in terms of meeting their needs where they're at?
Well, for me personally, if the caregivers, the parents or the foster parents or the grandparents, if they could just call the agency where they want services to happen, schedule the appointment right there and then during that first phone call. The way the system is set up at this time, it could take over a month from the initial phone call to request services to the day they sit down and speak with a therapist. And when there's an urgent need, a whole month, that's too long.
It is.
By then, the emergency may not even exist, or they've even gotten into a worse situation.
Yes. And I've been there, where you give up. There's a window of opportunity when you want to seek help, and then sometimes if people close the door, that closes.
Exactly. That's it. That's it. You've lost them. So if they could just call the agency directly, schedule the appointment right then and there with a therapist that meets their criteria. I want a female therapist who speaks Spanish.
Right, a Spanish speaking.
Yes. And be able to see that therapist within a week at the most.
So better access points.
Yes.
And maybe more access points.
Yes.
And I know it's hard. I think, the system again, I keep using that phrase, and I don't mean to offend anybody, but I think there's this sense that we want to track people when they come in. We want to understand their diagnosis or whatever their presenting symptoms are, and that we want to sort of track them as they move about, and who they get referred to, and sort of control that in a way, because you don't want everybody going to, say, Stanford Youth Solutions, or and so I understand the purpose of that, and I think that's sort of why they do that, but it makes it difficult for families and youth to access services, because there's all these hoops you sort of have to jump through. And it really makes it very difficult, that bureaucracy. Years ago, they didn't have that. Years ago, you could go places. But as Sacramento got larger and larger and served more clientele, I think that really kind of push that sort of having that gatekeeper role and
Right.
having, you know, kind of being able to control sort of the volume and some of those things that were kind of in tracking and the evaluation and all of that. So I can certainly understand that, but when you're in the trenches and you're a family that needs help and you want to make that phone call, you want something within a few days.
Exactly.
Yeah.
And then it gets confusing because it's all these people calling you from different places. You don't know who is calling
Right.
from where, and that just adds to the frustration.
Well, and I know what I experienced myself and my family and some of the things that we went through is that, you know, we don't want to keep telling our story.
Right.
Exactly.
It's like, it's exhausting, it's painful, it's emotional, it's kind of, in a way, almost dehumanizing to have to keep saying it over and over and over again.
Well,
and
we're
over.
re-traumatizing ourselves. That's, you know, let us tell it once, maybe twice, get us the help we need. Yeah,
and it's-
that's a good answer to the miracle
I
question.
love the answers. Thank you so much. So better access points and not having to tell your story so many times.
That
Yeah.
for me would be it.
Yeah, wonderful,
Yes.
wonderful. What do you think, Anne?
I would love for advocacy to be within child welfare and the probation. I believe that if there was an advocate, a parent partner for every 5 social workers or probation officers, I think that would just be the greatest thing, you know, because to kind of get in there and it would just be a thing of beauty. I recently learned that San Bernardino actually has that.
Placer County does.
And oh my goodness, let's do that.
Yeah.
It's time.
And it seems, and you know, I'm not the expert on everything. I think I am sometimes, but that with Mental Health Services Act dollars, that would be a wonderful use of them. You know, particularly for those kids and families that have mental health challenges within those other systems.
And one thing to add to that, Ann, too, is if you're going from Placer County to Sacramento County, the system looks completely different.
It does.
And you know, other
Or El
counties-
Dorado, or I mean,
Yeah.
it's all. There's no systemized.
And you know who it creates chaos for? The family.
Yes.
It's
And the
already in
youth.
chaos.
Yes.
Right.
That there's the caregiver is already probably at risk for depression and all of those
Checked
things
out.
because it's so difficult to care for the situation and exhausted and we just make it harder.
Oh
we
my
make it harder
goodness.
instead of making
I
it
dealt with
easier.
that a year or so ago. A young man transferred from Placer County, and what a mess.
Yeah. Yes.
And it was really, you
No
know,
smooth transition. So
caregivers making, 10 phone calls a day.
God, it breaks my heart to think that
Yes.
that's some of that
And that's
stuff.
somebody who probably is
Functional.
Functional and doesn't have a language barrier.
Right,
Doesn't
right,
have a
right.
culture barrier or
Right,
anything like
right,
that.
right.
So,
No, that is a huge added, I think, layer for people because I know how hard it is to navigate. You know, we've all navigated on our own, and then we do it for other people and we help others. I can't even imagine how difficult that would be if it wasn't my native language. And
Right.
and we all know mental health has its own language to add on top of it, and so it's you feel lost. I can't imagine that you wouldn't feel lost, you know. And I think we talk a lot about engaging people from the underserved communities, serving them better, having being able to penetrate those communities and really get the mental health supports to them, but yet we don't do things that make it easier for them to access it.
Right, right.
We don't
Exactly,
make
yeah.
those pathways a little bit easier, and I think we're starting to, but change is slow to come sometimes. But I love your idea about having the family advocates in the other systems.
Yeah.
You're speaking my language is something I've kind of dreamed about for many years.
As have I. As soon as I realized, I thought, what do you mean we're not
This
in there?
disconnect.
yeah.
Hopefully, whoever is watching who can sign those lines.
We know Michelle. She used to be our mental health services coordinator in Sacramento. She, I believe, is the head at Child Welfare and others. And we used to have a family advocate at Juvenile Hall years ago, and that sort of
Yes.
has gone by the wayside. Not quite sure why. I think maybe funding. But there is a lot of dollars in Mental Health Services Act, and this should be a high priority because these are who the
is.
system exists for. You know, these needs are high priority.
The grants are out there, the money's out there.
Yeah, I think so. I think it's really about coming together in collaboration
Right.
and making some things happen, and and maybe something that the Family Advocacy Committee can work on. I'm going to challenge you. Well, because there's this Mental Health Services Act Steering Committee. They're looking at expansion of CSS programs, community services and supports. I believe all the family advocates are funded through community services and supports in some way or another, or a portion at least, and so that may be something to consider, because those things really do need to happen. The problem sometimes is, well, we don't want to pay for child welfare, or we don't want to pay for, but we all need to be looking at this as these are families that are intersecting
Exactly,
with all
the
of
bigger
us.
picture, yes.
And
they
how can
do.
we best support them and provide that robust service delivery and ensure that there's also that family voice within those systems of care?
Right.
Yeah.
Right.
Definitely.
Because that piece is important too, not just the direct service piece of it, but really that advocacy piece. To know that that decisions are being made with being informed by families that have been served in the system, being informed by those needs, because you people know the needs better than anybody because you've been there.
Live them, yeah.
Yeah.
Right.
I know there's the peer certification bill that Senator Mark Leno had come out with, and that was a very, very important piece of legislation that many of us have been waiting for many years. Several other states have a peer certification process, and many. And I used to think years ago that California was kind of ahead of the curve when it came to mental health and some of these things like family advocacy and client advocacy and that whole movement. And then we sort of fell off a little bit. We're a little bit behind the curve on some of those things now, and so we're very excited to see that. And hopefully, we have full implementation of that in the near future. How do you guys feel about that? And what are your thoughts? And 'cause I hear mixed of different things.
Yeah, I think, at least personally, I'm on the fence about it, because for me, first of all, I don't really know how they're going to implement the training portion. If it'll be up to the family partner to pay for the training, and I know it's not a cheap training.
Right.
So I don't know who's going to pay for it.
Some of it made through like OSHPD grants, the Office of Statewide Health Planning and Development. They're funding a lot of those things.
They're funding
right
the
now.
training, yeah.
Right.
I know of 2 bodies that are offering the
Hopefully,
trainings,
yes.
which is good.
Us being one of them.
Yeah,
Yes.
Stanford is one, and
being one of
UHCF
them.
is another.
Well, that's through the OSHPD. We have one. We have a grant through them as well, and it's the
Right.
same thing. But I think
Yes.
there'll be bigger grants through OSHPD for some of this as this
Okay.
comes
Right,
through.
and it's not that I'm against the training. I think the
Right,
training,
Oh, it's
learning
invaluable,
continues.
yes.
It's very, very valuable. But as long as that lived experience continues to be at the forefront
Yeah.
I agree.
for being able
Yes.
to be hired on as a family partner, that's what matters to me. That's what counts, because I'm sure there's many people out there, clients of ours, who would make wonderful family
Oh, my
partners.
goodness.
Absolutely.
And I would hate for training to be the deterrent for them to be hired on. So
Yeah, interesting. I hadn't heard that. That's a really interesting perspective, because that is so important, and you don't want to see that be a hindrance. One of the things and maybe you folks have as well, is that you don't want them to only to be forced. You don't want peer and family advocates to only be forced into the box of being billable hours.
That's what
right,
it is.
and that's
That's
what
what
it
it's coming
comes down
across
yeah,
as loud
to
and
dollars
clear.
and cents.
We're getting
yes.
our own codes, and
And I think it's long overdue, but it shouldn't be the only role.
Right. Right.
Oh, as family partners, I know in my experience, I have been used as a mental health assistant, so I can bill. I've been used as a, rehabilitation of other areas. So there are ways, but when we work with the family or work with the therapist, then it should be considered a collateral.
Right.
Not just a case management, but a collateral.
Right.
Because our input is a reflection of the families that we're working with.
And I think some places may do it that way, but for the most part, I don't think a lot of the work that family advocates are doing is being reimbursed. And so I kind of always thought it was a way to have a little more security in your position, because if there's some leveraging of dollars that can be done, maybe if the budget goes under like it did a few years ago,
Right.
things don't just get wiped out,
Right,
and so that was one of the things, one of the reasons why, I was always very supportive of it, but I also don't want to see it become the only role or constrain you in your work, so that you can only do such and such for 30 minutes, for this
Exactly.
particular
Right,
family.
right, because we have to have 720 minutes,
Right?
of
That could be
billable
tragic.
time.
That could just be tragic.
Of course.
I'm
And we
sorry
already
I can't
see
go
it
to your
with-
IEP because
That's my point.
Exactly.
And you know what
we
it
already
takes.
see it with the therapist that they only have a certain number of hours per week that they can
Yes.
allocate for their
Right.
clients. Just the transportation, because therapists sometimes have to see the clients at school or their home if they're not able to come to the office.
Right.
Just the transportation time alone.
it fills that up.
Exactly.
Yeah.
So I think some of that remains to be seen, and perhaps we can continue to advocate and synthesize some kind of voice around that so that we make sure that it doesn't wipe out sort of the existing role of family advocates as they are currently defined and as they're currently working within the system.
I went to, I don't even want to call it a training. It was held downtown at the Pagoda, and it was probably about 2 years ago. And it was
Working well together?
working
Working
well
they did a lot of
together.
this.
Yeah, they did. They said they kind of
Absolutely.
got the ball running. And I was really excited because I was going to learn a lot about it, and I thought it was going to be a forum where we could ask questions. And it literally was, what's your question, what's your statement, and then nobody responded. They just wanted our input.
I think that all went into the OSHPED documents. If you look
Yeah.
on the OSHPED's website, you'll see the Working Well Together plan. You'll see the some of the documents around sort of their 5-year plan about some of this. It's really important. We've learned a lot because we've been on a couple of grants with them recently with the Office of Statewide Health Planning and Development that I am very excited about, but I'm learning more and more about sort of some of the underlying work that's been done and the data that's collected and the research that's been in existence to sort of carve out a plan. What I'm not so thrilled about is the level of involvement and sort of, I think it could be greater. I think that we could have more of a voice and sort of shape it in the way that the family,
Exactly.
the youth, and the peer advocates really would like to see it.
And that was my point.
Yeah,
It really took a lot of the empowerment away. And as Ciamora said, don't talk about us without us.
Right.
So here you are asking us our input, but you're not having the conversation.
Yeah, having a dialogue about
Yes,
it. It has to be a two-sided, not
Yeah.
just one-sided. Right.
And I think a concern that I have, that I've been talking about recently is we're still not quite clearly defined, or not all of us are, right? What are our roles? What's our title? What can we do or can't we do? And if this peer certification piece comes in before that, my concern is that it would just add to the confusion.
Right.
When we're already all kind of trying to figure it out.
So sort of what it sounds like we need is really a systemized sort of definition of what a family advocate is,
Absolutely.
what the role is, consistent across the system.
They've come
Yes.
across with that already, the peer support specialists, the family support specialists, and the parent support specialists.
Right. But I mean, I think we as agencies are doing that. I don't know that it's been driven by any kind of
That's part of the bill.
Oh, right. I see. I do.
But just as we talk about our duties within our agencies, there's no streamline. There isn't.
Right.
Right.
And I think if we should, recently when I started at Stanford, there's their mission statement, and all new hires have to memorize it and then repeat it. Wouldn't it be awesome if we came up with a standard defining mission?
Peer partner oath.
Right. so that agencies everybody could say the same thing,
Right.
Yes.
And of course, there's always going to be movement.
Yes.
Everything's
Yes.
always going to be
Up for
fluid.
interpretation, yes.
Yes, but I
But
think
yes,
that's
that standard, it kind of
Exactly.
lays out and is before us, and those core competencies, so the lived
Right.
experience and, sort of some of the other things that we know are so important to this role as far as, making sure that you don't judge or you don't,
Or your ethical standards.
Yes, all of those things I think there's a peer support code of ethics that we use. We always hang it up in all of our locations and make sure that people revisit that frequently, because sometimes it's really easy to do and you really start trying to fix problems for everybody and then you go, wait a minute, let's go back to this and take a look. Are we aligning our values with these type of things?
Yes.
But I think as a system, I really like that idea of having sort of more of a clearly defined.
Right. More uniform. Yeah.
And I think you're right. If this all becomes implemented in the meantime,
right.
where do we go from there?
Right. That's right.
Yeah.
That's right.
Interesting. So what do you think? Is there more as far as the peer certification? I know you talked a little bit, but
Right. Well, as I said, I'm still a little bit on the fence because
yeah.
When I work with, I work mostly with the caregivers,
Right,
not with
right.
the actual client.
right. So with the family.
Yes. I don't feel myself as working here and the caregiver here. We're here. I'm not helping the caregivers.
Right.
We're working together to reach a certain goal. So we're walking side by side. And I don't want that training portion to It won't put me here literally, but in the consumer's perception, it could potentially have that.
Well, and in particular, if it starts to become around billable hours and things like that, it could really, really kind of threaten that relationship. In a way, I
Exactly.
think.
So I want to be able to remain here because it's learning both ways. I learn from the
Absolutely.
caregivers, they learn from me so that we can achieve that common goal.
And one of the things I've heard a lot about, and as we're working on this grant and we're doing focus groups all over the place with different partner agencies, people want to retain their peerness. You know, don't have us lose our peerness. You know, who we are as a peer, as a family advocate, as a peer advocate. Don't kind of morph us into something else, or because it's easy to happen. And as you see, even over time, it's happened. With it was very pure family advocacy in the very beginning, but as it kind of filtered out to the different agencies, people interpret it different ways. Some family advocates aren't really even doing advocacy. I hear these things.
Right.
Oh, it's true.
It is true.
Yeah,
Some are doing clerical work.
Right, right. No, that happens, and so to sort of make sure that doesn't happen is really essential. And I really would like to encourage all of you to have your voices a part of that. As there's because there'll be some meetings, there'll be convening, and I want all your emails so I can make sure I send you things. Because we often have an opportunity to weigh in on some of this, and we'll be hosting a panel towards the end of June to talk about peer certification. So it would be really great to have a family perspective. It was kind of focused more on client advocacy and the peers on the adult side, but as I'm talking to all of you, I realize how important it will be to make sure that we have the family voice.
And we have a leadership team within the Family Advocacy Committee. We're not voted in, we're volunteer basis. And one of the things that we do make a point is when we know that there's a new family partner or family advocate that's been hired on, we extend an invitation to our meetings. We go out and talk with them. We do coffee, and we kind of share the things that we do at our own offices, and that can give them an idea of the things that we're supposed to be doing and not supposed to be doing.
Right. And that in itself is really a network of support. Because one of the recent grants through OSHPED is to build networks of support with the peer workers. So whether it's family advocates or peer specialists. To make sure that they're supported in the workplace, because as I'm sure you know, I don't have to tell you, it's really hard to find that support sometimes when you're sort of the one family advocate or the one peer advocate, or just maybe a couple of you, everybody else in the agency is doing different functions. There can be this otherness, and so how important it is to make sure that people are supported in that, so that we're taking care of our own mental health and wellness.
Exactly.
And you mentioned also, both of you were talking about the unevening of the certification. And, right now, where we are and what we do as family advocates, it is not clinical.
Right.
It's not clinical. Right. And bringing in service codes and bringing in a certification, that brings it up to that clinical level. And one of the reasons that we work so well with our consumers is that we're not clinical.
Well, I think the goal, and I could be wrong because it really has a lot to play out here, and there's, with the old expression, the devil is in the details.
Yes.
Yeah.
But from what I've read, it's really a set-aside classification, so you're not doing the clinical. But generally speaking, I think that person will have to be linked with the clinical team. Sometimes people want to come to us, and it's a little bit easier for our agency because we don't provide the clinical services. So our whole agency is an advocacy agency. Our advocates work within the county's treatment system, but we can serve people that come in and just want advocacy. They don't necessarily aren't linked anywhere, or maybe they're linked somewhere, but that's not why they're coming to us. They want to come to us for some support group. They need an IEP. To have that kind of flexibility, I think, would be ideal. So that if somebody came to your agency and only wanted to see the family advocate, they could.
Right.
And perhaps under that billing code, they would be able to.
That would be awesome.
Well, they send them to us anyways.
Right,
You guys
yes.
get them too?
I do.
Yes.
You do. Well, that's actually good. Actually, I'm so happy to hear that.
And that's a wonderful thing
The
about
referral.
my agency is that they're very supportive. That
Wonderful.
I get phone calls, I get people coming in that
Yeah,
are not clients, and
Right.
they don't tell me, well, you can't bill, so turn
Because they're
them
not
away.
linked. Good.
It's
good.
the other way around.
Yeah.
That's good.
Because we should really try to make sure that people are met where they meet them where they are.
Exactly.
Not like, oh no, we can't.
Yeah,
help
I'm sorry,
you.
not- yes.
Go knock on that door,
Yeah,
and
but
they might
here's
send
a
you to the
number,
next
and-
door.
yes.
Exactly. It's sort of those warm handoffs and no closed door and all of that.
Needs to go beyond the surface of, you know what, we have a family advocate you can talk to, and then after you do, are they an intake? No. Oh, okay. then don't call them back, or don't do this, or don't do, you know.
Right.
And one thing I wanted to mention about the smaller agencies is that, you know, when you're just alone or you just have one other person there, after a while, everybody appreciates initially your story and why you're there, but after a while, it just becomes not as important. Your story becomes not the piece that it should be. I'm not sure I'm saying that right.
I totally understand what you're saying, and I'm not sure I know how to articulate it fully, but I felt it, and I've been there, and I know that many other people have expressed that to us. And I think the great thing about UACF working on this particular grant that we're working on is they'll hopefully be assessing some of that from the family advocate perspective. Where our grant is focused more on the adult peers a little bit more, but how important it is to make sure that we are kind of addressing some of those things. And so some of that, the idea of these OSHPED grants is to sort of obtain this information, provide some training and supports, but also it should feed into a larger plan. Like, these are some of the trends that we're seeing. These are some of the things that we, you know, think are hard. What I've often heard is, please don't put me by myself.
Yeah.
You know, can we at least have 2 or 3, or, you know, and we recently got a contract with Kaiser Permanente, and we've been really, really happy to see, kind of moving on to the private sector is looking at peer advocates and family advocates in office, which was really exciting to me. And it's been an interesting venture for us because we've primarily been always a part of the public mental health system. So some real unique differences and similarities, but you know, they had originally talked to us about maybe having one advocate, and we were like, could we please have 2, you know? Because you need the support of somebody else.
You do.
You just really do. And I mean, these roles are very difficult. Not everybody is accepting. You know, even sometimes when leadership fully buys in, sometimes people on the team don't quite see the value right away, you know?
Right.
Or like, as you said, might see the value, but then after a while it's like, okay, you know, it's that same lady who's had a kid that went through the system, and you know, you kind of
Right. You need somebody to lean on when you are triggered.
Yes.
We're all going to be
There's
triggered.
got to be that support in the workplace.
Yeah.
Yes.
And so that leads me to my next question. It was on our list of questions, but you know, sort of how does it impact your personal life? And then I would add, how do you make sure to take care of yourselves? How do you practice self-care in your own lives to make sure that, you know, that you feel well and happy and healthy? And I know that's easier said than done sometimes.
Right, yes.
Yeah.
It is.
Because sometimes we're all moms and taking care of other people in our personal lives.
And
Yeah.
the transference, it doesn't just affect the therapist, but also us family partners.
Absolutely.
Many times we see ourselves in our clients and the caregivers, especially. In my
It can
case,
trigger things.
Exactly.
It triggers things for me sometimes. Yeah.
in my case specifically, whenever we get clients coming in that have dealt with exile in their homelands due to political persecution, that triggers me because of my background. As a child, I had to leave my country, Guatemala, in exile. And so that for me is a huge trigger. And the way I do self-care, I have a wonderful supervisor at work, and she's always very supportive. I know that she always has an open door for me to go get the care if I need it, but also outside of the home. I know it's easier said than done, you know, leave work at the office, but just being mindful that I have 3 kids at home that need their mom functioning.
Right.
So doing the things I enjoy, you know, reading, dancing.
Yes.
Yeah.
Yeah, having some fun. And trying to put
Exactly.
it aside because it's very easy to take home with us.
Oh my
Oh,
goodness.
yes.
You know, I
Absolutely.
see you all nodding. I know.
Oh,
you know.
yeah.
But
All
you
the
just feel so
time.
bad sometimes, and you want to help more, and your wheels just keep turning, and it's very hard to shut off. You know.
Exactly.
I know my 4 children are probably. One time I was at a conference, and I brought one of my daughter with me to San Francisco, and I said, she was, "Can I just stay in the room?" And I said, "Oh, well, just come down with me for a little bit." You know, I was only going for a short time. I said, "You can learn a little bit about mental health," and she said, "I think I know enough." You know, and I thought to myself, gosh, she's probably heard me talking about it like every evening, you know, and I just thought, oh gosh, you know, sometimes we really need to shut off.
We have to. I have to forget about mental health after 5 once in a while.
And take care of ourselves.
Exactly.
Yeah.
So Anne, how do you practice self-care, if you don't mind telling us a little bit?
Well, I have a tradition with my children. We're not doing it quite as often as we were doing it, but we'll go and see movies. We were doing it once a week. Yesterday we went and we saw the new Avengers movie.
I was going to ask you if you did. I missed
I was so excited. I just love the Avengers. My son got me into that, and so I really had a good time because this work becomes This work becomes part of who we are.
Yes.
Really, once somebody will ask you to define yourself, and suddenly this becomes a piece of that.
who we are.
So every 3 weeks I go and get my nails done with my oldest daughter. So we try, right?
Yeah,
Not always
absolutely.
successful, but
No, but I love that you're trying. I love that you see that that's important. You know.
Right, right.
So, Janet.
I'm really not that good at self-care. I run myself ragged. I have 3 children at home, 9, 10, and 17. And my history is in recovery. So I'm glad that I'm there and with them. And when I leave work, sometimes I go home and I think how lucky I am to have my children be who they are. And I don't take credit for it at all because it's not my doing. So we do Cub Scouts and Girl Scouts and soccer and church groups, and then I'm on the committee meeting and I go to my own
Okay, so
groups.
what I'm hearing, Jenny,
Right, exactly.
and I'm there too. I mean,
Yeah.
my kids are in sports and baseball, and so, and I spend a lot of my free time there.
Yeah.
And it's one thing if you love it, but you still need to take care of you.
Well, what I do though, and this sounds really bad, is I
Seahawks?
Go Seahawks.
I love it.
Thank you.
Okay, I'm a Patriots fan.
Oh my
Watch
goodness!
it.
Congratulations.
Thank you. Thank you.
Tom
Brady's my hero. No.
Oh, now you really went there. Russell Wilson.
I really
Self-care?
respect him now. He's great.
I have 2 jerseys too. So I zone out on TV.
Yeah, but that's
I zone out, and because my son even asked me the other night, "Why do you watch these shows?" I said, "Because they're worse off than me." You know.
I know. Sometimes I watch
You know,
really bad ones.
Once the kids, we all get home, everybody's fed, everybody's had their activities done, and everybody's tucked in, and we get in our little routine, and then I can just sit there from like 9 to 11 and do nothing. And what it is for me is hearing my own thoughts, not having everybody else's voice in my head. Not hearing the mommy, I need this, or hey Jenny, can you do that? It's just being alone in my thoughts. Yeah.
Well, that's great. I don't think it's bad at all. It's sort of a little bit like what Ann was saying about the movies. It's kind of losing ourselves. It's sort of
Yes.
forgetting about all this heavy stuff for a little while and just, kind of lightening the mood. Well, I tend to watch some of the really bad shows. And one of my favorites is Shameless, the Gallagher.
Oh my goodness, I
It
love
makes
that
my,
show.
dysfunctional family
Yes.
look really good. Sometimes the kids are like, "Are you really watching that?" I'm like, "Yeah, I
love that show.
I love it."
Yes.
But you just have to sort of break that a little bit and get away from it. So I'm happy to hear that you're all able to do that because it is a little bit hard. And I really loved what you said, sort of when we're telling our story or defining ourselves. This is a piece of who we are.
Yes.
And I think it's a really important and valuable piece, but it can't take over the rest of our
Right,
lives.
right.
And I know I've been very guilty of that from time to time because you do take things home
Right.
with you, and you and for me sometimes I even will work on things or try to help things at home because you just don't want to give up on these families, and
Right.
and there's one more piece that needs to be connected for them, and so those things do happen, but our own lives are really important, and we
It's
can't.
important too that if you're
Because you're a role model in a
Yeah,
way.
if you're at home with your family and all of a sudden a client or a consumer comes into your mind, to me that tells me that I need to find out why this is so important. Question the motives of why it's in my head right now. And did I not leave it there? Did I not try as hard as I could? Or is it because this is consuming me?
Well, I think what it is, and I think every one of you touched on it, is that there's just not the resources out there. Like,
Right.
That's
if
what
they
it
were
is.
there, we'd find them for them. I know for sure that all of you would find them.
Exactly.
And it's sort of kind of dealing with that reality, sort of that harsh reality that there's just not enough for folks. Every time one of our kids gets placed out of county or into
out
a
of
hospital
state.
or out of state, I just there's this crushing feeling inside. Like, did we? And I know it's not the family advocate's fault. I know that you can't place that upon any one individual or agency, but it feels like
we
haven't
make it
done
feel
enough.
so.
Yeah.
And when we've been there, we kind of know
Yeah,
When we get
what that
call
looks like.
Yeah.
yeah,
on a Thursday afternoon that I'm going to get evicted tomorrow,
right. Yeah.
we just take it so personal that we are not able to find that housing situation.
Right.
We just can't. There's no resources.
Right.
But then the weekend hits for us, and we're there thinking,
It's so hard not to.
yeah,
right?
that
Yeah.
family is not.
Where are they?
Yeah. Where are they? What is
How
going
did they
on?
end up? What's going to happen with them?
Yeah, exactly.
And one of the, I don't really want to put the county down by saying this, but one of the shortcomings is because I'm so close to the alcohol and drug treatment programs and whatnot, that it's in our continuum that we have residential care for our youth, and there isn't. We literally ship our
pretty
youth
much
out of
non-existent.
county,
Yeah.
out of county.
And
No,
and
I agree.
I
I
understand
agree.
because it's not just the children who are dealing with the alcohol and drug
It's
system.
also the mental health.
And not
the
just that,
families.
And
but
the
children
families.
who have physical disabilities,
Absolutely.
who are
Yes.
facing a mental health crisis. And I
Right.
know this from personal experience. My oldest son, he has cerebral palsy and hydrocephalus, but he also has depression and anxiety. And on the times that we've taken him to the ER, 5150'd, we can't find placement for him. No,
Because of his needs.
Exactly. None of the
yeah.
psychiatric
Yeah, so
hospitals
really
want to take
once-
him on.
Wow.
Oh my goodness.
But people with disabilities tend to get depressed.
Right,
Right.
and
Yeah.
it goes, it's
Exactly, it
connected.
goes
So
hand
it's
in
really
hand.
back to this integrated system of care that we just need to keep up the good
Right.
fight.
Absolutely.
Well, I have really enjoyed talking to you all. I'm very inspired by you. You make me kind of think about my roots in this work and sort of why we do what we do.
Right.
And so thank you so much for being here today and for the
Well,
work
thank
that
you for
do.
having us.
And
Thank
that
you.
I can just see this love and compassion in all of you. And so that's so special. So thank you so much. And thank you for tuning in, and please tune in next time, and remember that your mental health does matter.
Absolutely.
When I think of where I've been, the good times and the bad, on a scale of 1 to 10, either way I'm glad, 'cause I'm not alone. As I'm reaching for the phone, your voice is there, you really care, you're my comfort zone. Sometimes when I'm lost, crushed beneath the pain, though I can't afford the cost, I just smile and play the game. But there's a healing place where I cannot pretend. Your smiling face, your heart's embrace heals me again. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny that I'm not alone. 10,000 times I've known my best bet is that first step for hope. Trying to stand tall, I'm haunted by the past. With my back against that wall, one thing is clear at last. The kind of love you show to me flows from an endless stream, with shores so wide it won't subside. My mind had never dreamed how I'm not alone. Even when I'm on my own, your gentle touch is much too much to let me roam.